having asthma and allergies. Okay, so please, if you can, please breastfeed your baby. Okay, so now we are done with the skin to skin and breastfeeding. Then we'll continue to transfer necessary for cleaning and measurements, and of course, to provide the essential care that I've mentioned earlier. So we'll go into one by one of essential care of baby after birth. So first of all, we need to protect them because all these are potential source of infection. So we need to include, which include umbilical cord care, eye care, skin care, and of course, talking about vaccination. Okay, so umbilical cord care. Just number one, we need to talk about what is umbilical cord. It's actually a vessel between the mother and the fetus for transfer of nutrients and also oxygen. After birth, baby does not require any support from the mother, so therefore our umbilical cord is usually clamped and cut. And again, umbilical cord does not detach itself immediately, so it can be a potential site of infection. Therefore, we need to take care of the umbilical cord to reduce any infection. Okay, so the next one, okay, just an example here. The part of the umbilical cord that's still attached to your baby is called umbilical thumb. This is the umbilical thumb. Usually there will be the clamp there, whereby if you see it like this, okay. During the first few days after birth, the thumb gets darker, it shrivels and eventually falls off. So you can see from the picture here, it looks very jelly cord-like initially, and it starts to shrivel and it gets dried up and starts to get darker and it falls off roughly about within a week to two. Okay. Sometimes after the thumb has fallen out, actually some of them might see some oozing from the baby's belly button. Okay, it might be clear, sticky, or brownish, or might leave stains on your baby's diapers or nappies. So it might smell a little bit, but then it's just part of the healing process. But of course, we need to know when to refer to the doctor. Okay, when. So if let's say the thumb hasn't fallen off after more than 2 weeks, okay, it will tell us that there could be some medical condition that we need to watch out for. And of course, if the cord starts to turn a bit reddish like this picture, and it gets very, a lot of discharge, it gets very foul smelling, it's painful and it's warm, please bring your baby to see a doctor or a pediatrician for assessment. Okay, so we're done with the umbilical cord. Okay, so sorry, how to clean the umbilical cord? First of all, wash your hands. Okay, avoid touching it whenever possible. Use water to clean your belly button area. For certain centers, if we do give Erythema spirit just to dry up the cord and to clean the cord to prevent infection. Make sure the stump dries properly after bathing. Okay, those stump that will dry and heal much faster if it's exposed to air as much as possible. Try not to cover it with plastic pants or nappies. Okay, fold nappies down and away from the stump if you can. And of course, never ever try to pull the stump off yourself, even though it looks like it's going to come off anytime soon. All right. Okay. So the next we will talk about nappy care as a general brief to go through a few things. Okay. So nappy care. All right. Again, our perineum, which is the buttock area, is prone to change in the skin barrier. Okay, causing skin irritation. Increased moisture, prolonged contact with the irritants such as urine or the feces, okay, may contribute to skin breakdown. Okay, nappy change should occur at regular interval and to avoid irritation to the perineal skin environment. Okay, so you need to look at the perineal area each time you change the nappy to ensure that there's no redness caused by either dermatitis or we call it fungal infection. They did mention that disposable nappies are preferred, probably because we don't keep it longer there and can be absorbed well. Okay, cotton balls or soft disposable towels with warm water are the preferred cleansing method. Of course, it's not wrong for you to use those fragrant wet wipes, but you just have to make sure that they don't get irritated or the wet wipes doesn't irritate the skin. Okay, so nappy skincare. You can always give them some barrier creams to be used on all neonates who are at risk of all this skin irritation. Okay, So you can apply tape around the buttock area to prevent all this irritation. So every time when you change the diapers, the remaining barrier cream, if it's not dirty, you do not need to really remove it, but actually you can even top it up for more to provide a thicker layer to protect them. Okay, those who are at high risk of those who have high risk of skin irritation are those who poops a lot and you don't have enough time to change, or those who pees and you forget to change or delay in changing of diapers. For those who use a lot of antibiotics, these are all special conditions, all right, that we talk about. Okay. So nappy, so this is a few pictures, two pictures that I'm just showing you that possibility that you can see when you change your diapers, when it turns bad like this, okay, or it turns very skin breakdown. And this is all painful. Your child may cry. Sometimes when a child cries, it doesn't mean that they're hungry. Sometimes you might look into your diapers, you might see something like this. All right. So if anything of this happens, just visit your nearest doctor or pediatrician. Okay. So other than the nappy area, we of course have to look into their eye care as well, because they do tend to have some certain discharge intermittently. So if any discharge appears on your baby's eye, wipe it out from inner corner to the outwards. Okay, from inner corner outwards with a single use of cotton ball. Okay, don't repeatedly use it on one side, and probably if there's an infection, you might transfer to the other side. So use single use. Okay, sodium chloride is just salt water, or we can always use clean water at home. All right. Sometimes, as I said, exudate or some discharge from the eyes can be a common occurrence in neonates, which is newborn. However, if there's an increase in exudate and it's purulent, means like a pus discharge color, may signify infection and will require medical review. So example, I'll show you the pictures of a very bad eye infection. Okay, this is purulent, reddish, swollen up eyes. Okay, especially it can be one-sided or both, such as like this. They get swollen up, dry, crusted sometimes. Okay, remember, if you see anything, of course, these are quite a bad one. If you see something near almost to this, please bring it over for a review. Okay, they will need treatment. Okay. So other than that, the skin. Okay, these are the common things that we do look for the skin. Is called neonatal jaundice. Okay, or we call it it's basically, what does it mean is it's actually just a yellowing of the skin and whites of the eyes, and it's very common in newborn babies. Okay, it's usually most of the time jaundice are harmless. They clears up within the 10 to 14 days. Okay, and there are two types of neonatal jaundice in newborn. Physiological means it's a normal process, natural process, and this is the most common that we see. Of course, we cannot deny that certain disorders that may cause high jaundice, we call it a pathological. So usually doctors will or the nurses will look into if the child is well, any signs of infection, to determine any is it a physiological jaundice or a pathological jaundice. Okay, so why do babies get jaundice? Okay, these are very remember, every baby will get jaundice, whether is it a high jaundice or low jaundice that requires treatment. Okay, newborn babies will have, okay, first of all, why do they get jaundice? Yeah, newborn babies will have extra red blood cells they no longer need, which will break down rapidly when they are born. Okay, this process produces a substance, what we call it bilirubin. Okay, that's why we always talk about SBSB, or we take serum bilirubin. This is what we are looking at. Okay, which initially is a fat soluble and is converted to a water soluble form by an enzyme produced in the liver. So which means that they need to be excreted from the body by being converted to a water soluble form by an enzyme in the liver. Then they will be passed out through the stools or sometimes in the urine. Okay, so because of newborn that have immature livers, some of the babies may take a few days to actually for the enzyme to be produced to to convert it to water soluble to be removed. So sometimes, as you said, commence of feeding to start producing the enzyme. So as early as possible, if we start feeding, then the liver starts to move, then it can produce the enzyme earlier. So we always talk about increased feeding, more feeding, or early feeding. Okay. So whenever these bilirubin are not being excreted or not removed, they will start to accumulate in our body. They will store in the skin and the whites of the eyes and start to turn yellowish. Okay. So again, all these processes are what we call as physiological, which is a normal occurrence in every baby. But if those who comes in very early jaundice within 24 hours, or those who have infection, this may trigger even higher jaundice that we will require early monitoring and early treatment. Okay, so we just have to be careful about pathological jaundice, which is caused by abnormal infections or liver disorders. Okay, so the only way to treat a neonatal jaundice, not the very high jaundice, usually it's just using phototherapy. Okay, what does phototherapy do is that it produces the blue light actually to dilute or dissolve the bilirubin to be excreted. Okay, so why is it important? Because we need to prevent high jaundice, which may deposit in our brain. This bilirubin itself can go into our brain and deposit on certain parts of the brain to cause damage to our brain. So high jaundice can be very dangerous. Okay, the condition we call it kernicterus. Okay, and very commonly we do have parents coming in telling me that they put their babies under the sun to remove the jaundice. Based on the guideline, it's not recommended because it's always there's a risk of dehydration, sunburn, or hypothermia, which is called overheating the baby. So we would try to avoid all this so that we do not cause any of this to your baby. All right. Okay. So yeah. So basically, we have done almost up to this area already. Okay, and not a few more to go. Just talking about vaccination, the vitamin injection, vitamin K. So at birth, there are a few medication and vaccination will be given before discharge. Vitamin K, BCG vaccine, and hepatitis B vaccine. All right. So the next, usually people will start. They don't carry much because we never really explain why we usually give vitamin K at birth. So let me show you why do we need vitamin K at birth. So all newborns are given 1 milligram of vitamin K intramuscularly at birth. Usually, if possible, to do it after the first hour after the mother was given skin to skin or breastfeeding. Why is it important? Because vitamin K is to prevent hemorrhagic disease of newborn, whereby it can potentially cause a fatal bleeding disorder. Okay, why is it so? Because vitamin K is part of a clotting or pembekuan darah, part of the pathway. So that because baby only have minimal vitamin K reserve, okay, in their liver during the time of delivery. So they are not able to synthesize enough vitamin K due to, we call it sterile gut. So because of this, they realize that the baby some of them gets bleeding very easily, which can cause death. So then from there on, every babies are given additional vitamin K at birth to prevent this disease. Okay, so I hope that I give you some idea why we give vitamin K. So these are the charts from the National Immunization Program for Children. So as you can see here, at birth, 0 months, BCG and Hep B. Okay, so subsequently, there won't be any vaccination until 2 months old. Okay, so I'm not going to talk too much on the subsequent vaccination, but then I will talk about the extra vaccination that is not in the National Immunization Program for babies that are less than 6 months old, which is, we call it oral rotavirus vaccine. It can be given as early as 6 weeks. We do give it at 2 months old. Okay, so this is to prevent highly contagious rotavirus-associated gastroenteritis, which is diarrhea and vomiting in babies. So these are the additional ones that you can get it in private sector, all right? So those who are starting at 2 months old. And of course, different brands, different doses. Generally, it depends on where you go to. They will explain more on the types of the vaccine that they use in their center. All right. So we do recommend if you are getting extra vaccine, try to get this oral rotavirus vaccine. Okay, and of course, other screening that we usually do before discharge, you're talking about newborn hearing screening. Okay, again, subject to availability of the machine in your center. Okay, government, yes, they do all this because it's part of the universal neonatal hearing screening program in Malaysia. Okay, to detect hearing loss among children at very early age. So what do I practice here is that because my center is currently getting our machine, but I do tend to refer them out to a private hearing center just to get them to do screening to detect if there's any hearing loss in newborn babies. Okay, so before 3 months old, and of course, no later than 6 months. Okay, so those who have a newborn that has not done any hearing screening yet, we will advise you to go for it, and you can always ask where to go from your nearest doctor. Okay. So just a quick go through of a few skin lesions that may actually confuse parents. They might think it's something abnormal, but honestly, these are all normal skin lesions. Sometimes you may see some red dots, white dots on the skin of the body of the baby. Okay, so we call it Erythema Toxicum. Most of the time the baby are well, just that they get a few dots on the face, body, and limbs. If you look into the mouth, if you see these two pearls on the we call it at the palate of your baby. This is what we call Epstein pearl. This is normal. It will go away when you grow up. And sometimes you might see some dots on the nose of your babies or on the mouth here. These are called milia. So basically, keratins, we call it over the pores of the nose or the skin. Okay. So but of course, if anytime you see anything abnormal and it's not convincing enough to be normal, always seek medical attention. Okay. Well, just now I did mention about sudden infant death syndrome. Okay. Okay. So this is something that we need to advocate parents to talk about sudden infant death syndrome after discharge. Sometimes, first of all, we need to tell them that if you put a baby, make sure the crib is properly assembled. Always put the baby on the back to sleep. Do not, because some of the parents, they want to make the baby's shape, head shape looks nicer. They tend to put them on sleep on the tummy. No, we do not recommend that. Always put back to sleep now. Huh? Sleep means the back on the bed. Okay, so again, smoke-free. Do not smoke around your baby. Okay, remove everything other than the mattress and the sheet from the crib. Don't put a lot of dolls, okay, all this, we call patong around the crib. Use firm mattress, not more than 2 finger width between the crib and the mattress. Do not overclose your baby while sleeping. But of course, should not be hot to touch as well. All right. And the gap between the crib should not be more than a soda can width. Okay. So there's a risk of falling out from the crib. Again, we would try to tell parents to separate. Do not put baby to sleep on the same bed because one thing is we worry that if mothers are tired, they may actually somehow unintentionally probably sleep on top of the baby. Okay. This is very controversial, but sometimes we do tell them that once breastfeeding, you can always offer, sorry, it's not after, it's offer a pacifier. It's controversial, but if some of them practice this, and of course, use a blanket sleeper, don't use too much of loose blanket because it may actually suffocate the baby during sleep. So all these are the ways that we try to prevent sudden infant death syndrome in babies, okay? But if you need to know more, please visit your pediatrician. They will tell you more on that. And of course, I have a very good website to show you all to talk about how does a newborn or even babies up to toddlers, preschool age to teens. There are a few topics that you actually can look at. This is actually a website by the Australian government. Okay, they talk about behavior, breastfeeding, even talking about development and healthy daily care. Okay, you can always visit this website. Okay, just to get a bit more understanding on a few things of care of the newborn or of your babies after discharge at home. Okay, all right. So I think that's all for today. I know it's a bit lengthy, sorry, but thank you very much for your time. If you do have any questions, please feel free to put it in the Q&A section or chat. Thank you.
Well, thank you so much, Dr. Chung. That was indeed a very interesting and information sharing. So next, I would like to invite Mr. Poon Kai Yu, the Regional Sales Manager of STEM Life Sdn Bhd. So he will be sharing with us about the wonder of stem cells. While Mr. Poon share about his topic, for those of you who have any questions, do let us know in our comment box. Mr. Poon, this session is yours.
Oh, thank you, thank you. Just give me a minute. Hi, good afternoon, everyone. I hope that won't be dragging too long. It's a Saturday afternoon. Topic like stem cell could be a little bit scientific, but don't worry. Just sit back and relax. Just treat it as a awareness or general knowledge. Okay. So first of all, congratulations to all mothers for your pregnancy. A little bit about our company background. We have been established since the year of 2001, almost 20 years in business. And up to now, we have more than 60,000 parents entrusted their cord blood with us. And we have done a number of transplants over the years. Okay. And we are part of Cord Life Group from Singapore. It's a public listed company with presence in 11 countries in the region. Okay. So what is stem cell? Stem cell is actually a master cell in our body that has two characteristics. Number one, it can actually multiply. It can duplicate and multiply. So whatever cell that die off, you actually get a new one to replace the old one. Okay. And then another one characteristic is that it can actually replicate, or it can form into different cells in our body, be it our skin cell, our blood cell, our organ cell, and so forth. So these two characteristics make stem cell actually very useful in the medical industry. So what's the difference between normal stem cell from an adult compared to from the baby? Because when a baby is born, we can harvest the stem cell from the umbilical cord, okay, the cord blood. And this cord blood stem cell is young and flexible in the sense that it's not contaminated, it's not trained. In other words, we call it's not programmed to certain behavior or characteristic, unlike an adult. That makes it more adaptable to any future changes. Okay, so this is a general anatomy of the cord. So from here you can see, like Dr. Chung just mentioned, the cord is the vessel that connects both the mother and child. But after the child is born, where the cord will be cut and the baby will be brought to a safe place. And then this is when and where the doctor, the OBGYN or obstetrician will start the collection of cord blood. Okay, so the needle will be inserted into the vein to collect the cord blood, and the procedure will last probably around 5 minutes. Okay, so from the diameter view of the cord, you can see there are 2 arteries and 1 vein, and there are some jelly substance around the cord. We call it Wharton jelly, and outside the cord is a membrane. We call it cord lining. So all these different parts contains different type of stem cell. Okay, so 1 + 1 = 3. It's Saturday afternoon. not here to test whether you're awake or not. Okay, what it means here is that when parents choose to store the cord blood plus the cord lining, we can get up to 3 types of stem cell now. Okay, number one is a stem cell called HSC or hematopoietic stem cell. This one is a stem cell we can get from the cord blood, and this HSC stem cell can form red blood cell, white blood cell, and platelet in the blood. Whereas there are 2 other types of stem cell identified for the past 10 or 20 years ago. They are called MSC plus and also EPSC stem cell. But bear in mind, these 2 other stem cells are still under research or clinical trial. So this type of stem cell are more to the formation of bones, cartilage, muscle in our bodies. So let's look into HSC stem cell. So what HSC stem cell can do currently is that it is actually used in a number of treatments. For instance, blood cancer, some tumors in the body, some non-cancerous blood problem like anemia or thalassemia, immune deficiency disorder, and metabolic disorders. So the one in both are the common one happening in the society, common one. And this list actually are recognized internationally. Is actually adapted from parentcordbloodguide.com from US. So in Malaysia, things like thalassemia is quite common. In fact, for a state like Sabah, 27% of parents have the tendency to be a thalassemia carrier. Okay, about 20% of Malaysian in general, they have a tendency to become a thalassemia carrier. All right, so where can we get stem cell? So up to now, the gold standard to get stem cell is from the bone marrow, our sum-sum tulang. Okay, another source is from peripheral. This is mainly from adult. We actually get the blood from the limbs. Okay, and then we process it to extract the stem cell out, and then we put into a patient to speed up the recovery. And then another source is from the cord blood. Okay, so let's see. Okay, for instance, if there is a patient who needed stem cell for transplant, one of the sources is actually to go to Pusat Darah Negara in HKL, where they will have a registry of blood this stem cell donor all over the countries. Okay, but unfortunately, the awareness level among the donors are still very low. So the source is pretty low. So as a result of that, most patients have to wait for a period of few months to years to get a suitable donor. Okay, and then while most so-called cord blood collection can be probably hello. Hello, testing.
Yes,
Sorry.
Mr. Pong, I can hear you.
Okay. Sorry. my screen is flickering. Okay. So another source is from the cord blood. The cord blood, although you probably pay a so-called face value, but however, you get to store this cord blood for your family. Okay, and it's not a public source, and nobody else can access to it except your own family members. Now, very important, one must know that in order to perform a cord blood transplant, Hla matching is required because your blood and my blood are different. So for example, by using the cord blood, by using the so-called bone marrow, you need 100% match, okay, between the donor and the patient. So, however, if you were to use cord blood for transplant, all they need is about 4 out of 6 match in order to perform a transplant. Okay, a more so-called layman term is that we treat the patient as a house. Okay, in order to get into the house, you need to open 6 doors and you need 6 keys for using bone marrow or peripheral blood. But by using cord blood, we only need to have 4 keys in order to access to the house. Okay, who can benefit from this cord blood banking? Of course, the baby himself or herself is 100% match. Among siblings is about 25%. And among parents, babies to parents is 50%. Because this cord blood thing, 50% comes from the mother and 50% comes from the father. Okay. However, bear in mind for genetic diseases like thalassemia, the baby himself or herself cannot use back the same cord blood. You have to use from another person who is healthy. Okay, and the probability of matching between a patient and a total stranger is about 1 to 8,000. 1 to 8,000. That's why the waiting period is so long. And because in Malaysia, we have Chinese, Malay, Kadazan, Dusun, so many ethnicity. So to make the matching even more harder. Okay, this is the cord blood unit that we store for the parents. Okay, although the doctor will try to harvest a lot of cord blood from the cord, it's about 50 ml, a big bag. But once this cord blood is transported back into our lab, when we process through the machine, we only get to harvest a little bit of HSC stem cell, the size of the palm. Okay, and we store this cord blood into this cryo bag, which is FDA approved. And this bag is specially designed with different compartments that serve different purpose. Okay, we have one portion, the portion here. The portion here is for the transplant use. The portion here, about 20%, is for future expansion, because currently there isn't any technology to expand the cord blood for further use or to share with any other family members. Okay, the smaller chip here on top is actually for viability tests to test whether the cord blood is still okay, still alive after 10 or 20 years of storage. And then another compartment is where I mentioned just now is for matching purpose. So all this actually comes into one cord blood unit. Okay, so in a normal hospital setting, so this cord blood unit we will store for a period of 21 years at a very extreme temperature of negative 200 degrees Celsius. So when the transplant is needed, we will transport this unit to the hospital and let this cord blood unit to thaw down to normal room temperature before the transfusion is started. All they need to do is just hook up to the IV drip and let it flow for about 10-15 minutes. Okay, because this cryo bag is ready or user-friendly method of storage. So far, all right. I'll move on to the next stem cell, mesenchymal stem cell, which I mentioned just now is still under clinical study. However, the potential use of mesenchymal stem cell is huge. So as to make it very attractive to parents as well as for the babies for future use. So what I can do is that, as I mentioned, it can actually form bones, fats, fibrous tissue, muscle in our body. And as a result of that, they are used in a number of studies involving stroke patients, heart patient, Alzheimer. And then they are also used to modulate some patient with HIV, okay, and type 1 diabetic. Type 1 diabetic are those preborn diabetic, okay. So where can we get MSC stem cell? Unlike HSC stem cell, MSC stem cell we can get in from more sources. One of it is from the cord lining, the membrane of the cord, okay. Then we also can get the MSC from the jelly substance inside the cord. We can also get it from bone marrow, adult bone marrow, fat, our body fat, the placenta. So of all these different sources, we can get the highest concentration of MSC from the cord lining, okay? And technically, we do not need to do a lot of matching, okay, compared to HSC stem cell, so that this MSC stem cell can be used within the family members, okay, the parents, the grandparents, okay. And another thing is that MSC stem cell can also be expanded. So if there is not enough MSC stem cell, we can always expand it for more usage, okay, for different requirement. Okay, some of the studies involving MSC stem cell have gone to phase 3. Phase 3 means they already used on human being, patients in a big sample size, and they're waiting for a period of 5 to 10 years to see if there's any complication. If there's no more complications, then they will file for FDA approval so that this treatment will be available in the hospitals. Okay, next one, we have an additional stem cell called epithelial stem cell, which was discovered about 5-6 years ago, okay? Before this, there isn't any technology to identify this epithelial stem cell. And StemLife is one of the company in the region that have this patent to EPSC stem cell. Okay, what this EPSC stem cell can do, it is used to repair things like our organ lining, the surface of the organ, for skin surface, as the name say, epithelial, it's more to superficial level, and also the eye membranes, okay? So it's different, HSC, MSC, EPSC, all different types of stem cells actually have different purpose. So one of the study done in Singapore, okay, and also in Vietnam, okay, concurrent to study using EPSC cell to treat patient with persistent epithelial defect. So what happened is that this patient have a white membrane that covers the eye, that cause the vision to blur, okay? And the golden rules for all these things now, like even is to perform a laser surgery to remove the white layer of the this defect, okay? And after the surgery, immediately the doctors or the researcher put on a membrane of this EPSC cell, and you see for a period of 3 to 27 weeks or months to see whether the eyes are getting better. But after a period of time, they found that about 29 eyes actually recover well, and they find that this study is quite encouraging. So always we need to know that this stem cell is not like first aid. For instance, if there's a cancer patient, a leukemia patient, the golden, the so-called the primary treatment is still the chemotherapy or radiotherapy, then only followed by stem cell usage. It's not that the stem cell itself can help to cure the leukemia. So what happened is that after the patient have undergone the chemotherapy, basically all the good cell and the bad cell in the body are all gone or dead. So in this period of time, this patient is very vulnerable to infection, because basically it's like an empty thing inside the body already. So a lot of external contaminants can go inside the body, and most of the time a cancer patient died not because of the cancer, it's because of the treatment. During the treatment, if they cannot fight, then they will succumb to it. In this period of time when the body is very vulnerable, this is when and where stem cell comes in to help to boost up the immune system and the recovery of the patient. So this is how stem cell works. Okay, when there is a patient who have heart attack, it's not the stem cell who comes to prevent or save the patient. The patient still have to go for a bypass or whatever procedure. Then only they put in the stem cell to actually build up the cell wall inside the heart to recover the heart even faster. So this is how it works. Okay, there are a number of case study of using MSC registered under MOH in Malaysia. So one need to know that whether the study is legitimate or not. So you can log into nmrr.gov.my. So I will just highlight a few studies that are ongoing. Number one, this is the use of MSC cell for knee cartilage repair. Okay, so after the knee surgery, they put in the stem cell to boost up the recovery, to build up the cartilage in the knee. So this is done in HUKM under Dr. Prof. Badro. So it's still under clinical study phase 2. And then they also use it for things like ischemic ulcer wound. Okay, and then next one, they also use for kidney diseases. This one is done in Seremban Hospital Mawar. They also use on stroke patient under Sunway Medical Center in Selangor. So Sunway Medical Center, they do have a research arm okay, that looks into all these clinical studies. Next one, stroke patient also done under another initiative. And the last one is actually used for heart condition. This one is under Sarawak GH, under Dr. Sim. So these are the available studies in Malaysia using stem cell. So stem cell is so-called very interesting thing and a lot of potential. That's why these people are investing their time and resources to find out more what the stem cell can do for the patient. Okay, then next one is the cord lining. So we also have the option for the parents, besides storing the cord blood, they can also choose to store the whole cord so that they can gain up to 3 types of stem cell. Okay, so when we collect the cord, we'll cut into pieces and then we'll put into this vial before we put into the tank to store for a period of 21 years. Why 21 years? Because in 21 years time, your baby will be an adult. Okay, they can be able to make their decision by then, whether to continue storage or not. Okay, so this is what I meant just now. The so-called obstetrician will collect the cord blood in this big bag, but however, we can only store a small cryo bag only. Okay. So these are all the tanks in our facility in KL. So we call it this cryo tank. And one tank actually can store about 3,000 samples of cord blood. Because you see in KL, everything's so expensive, including the condominium. So everything have to share. Okay, and inside we will actually arrange it in the sense that it's like a cylinder, everything in spiral, and we put the stem cell in a cassette, and this is how we store it for 21 years. Okay, and this is a cryo shipper. It's not a normal ice cream tank. Okay, the purpose of this cryo shipper is to ship the sample and maintain the temperature of negative 200 degrees Celsius for a period of up to 1 week. So this is used especially when we want to ship the sample all the way to USA, UK, or even a very far country for treatment. Okay, and our facilities is actually regulated by MOH. Every 2 years, the MOH people will come and do an inspection in our facility. And we are also subject to the Private Healthcare Act 1998. Okay. And our company is also accredited by AABB since the year of 2018. Okay. What it means to us is that by getting this AABB standard, it stands for, AABB stands for, used to be called American Association of Blood Bank. Okay, it's actually a very prestigious recognition. So by attaining this AABB means that our sample is recognized worldwide by all the doctors in all the developed countries like Japan, Australia, US, and even UK. Okay. Okay, so when you choose to store the cord blood with Stem Life, our package actually comes with a few insurance backup. Okay, one of the primary one will be Stem Shield Plus. Okay, what it means is that whenever a cord blood unit that stored with us needed to be used for a treatment, the company will disperse an amount of 50,000 Sing dollar to actually mitigate the cost of the treatment. Okay, for example, if a treatment is needed for leukemia, and so without we will get a confirmation from the doctor and the hospital, then the company through the insurance policy, AIA Singapore will give out a sum of 50,000 Sing dollar. Why Sing dollar? Is because our HQ in Singapore, they have a group policy with AIA Singapore, so everything is paid out in Sing dollar. Okay, then other things like we also assure that the stem cell will be alive when it's needed. So probably in 10-15 years time, stem cell transplant is needed. Then in case the doctor find that the stem cell is not usable or it's not alive, then we will actually back up with $100,000 compensation to the parents. Okay, and there are many other things that actually bundle together with this cord blood thing. Okay, so cord blood collection is okay. Go back to the previous one. Why this lump sum payments is important? Because usually the cost of a cord blood transplant and the cost of treating a leukemia is very, very substantial. Okay, like if you were to treat this leukemia or thalassemia condition in a private hospital, it will probably cost around 400,000 ringgit. Okay, and if you were to go to a semi-government hospital like UMMC, probably it will cost about 80 to 100,000 ringgit. So at least there is some backup for that okay, but if you've mentioned that you buy an insurance policy, yes, they do have coverage for leukemia, but at the end of the day, you do not have the stem cell needed or the suitable donor who are willing to come forward and willing to give up this stem cell for donation. Okay, so one-time opportunity means that this cord blood thing can only be collected during the birth of the child by the doctors. So there will not be any second chance to collect cord blood, the same cord blood, because child number 1 punya cord blood and child number 2 punya cord blood, they are all different. As I mentioned, they're about 25% matching probability only. So every child is different. Every individuals, they are different. So if you lose the opportunity to store now, then you might think, okay, I can store for my second child, but it's different already. Okay. So if you need more information about this cord blood storage, you can contact our representative in Negeri. Her name is Samantha. So you can reach her out at this number. Okay. Thank you. That's all from my side.
Okay, thank you, Mr. Poon, for a very wonderful sharing.
Okay.
It is something new for me as well. So we are now in the Q&A session. So let's see if we have any questions from the participants.
Yeah, anyone can type in the box, the chat box. Either you can ask Dr. Chong anything about baby care or anything about stem cell.
Okay, we do have one question here. Do baby hiccups mean they are freezing?
Okay, I think baby hiccups is one of the concern by most of the parents as well that I do get during their consultation. So hiccup, they may not necessarily mean they are freezing. It's just basically their expulsions of the gas or air from their stomach. Okay, it can be because of various reasons, because they swallow air during the feeding itself, or of course, if this is something very troubling, the hiccup that cause impact in feeding, or they can't feed very well, or they cause a lot of vomiting or discomfort, then definitely we'll need to examine to make sure that this hiccup is just not purely because of swallowed air, but can be other means of medical problem. So if it depends on your condition of baby, but if you do have your follow-up with any of the doctors in clinic kesihatan or in the private clinics, do let them know, and they will probably ask you a few more questions just to determine the underlying cause of it. Yeah. So freezing itself may not be just the reason behind the hiccups. Yeah. And okay, I think there's another question here. Belly button shape. Well, actually, there wouldn't be much of a difference in the shape of the belly button, unless if you see a swelling on that. But that could be what we call a hernia or something else. But I can't see from here because probably you might need to show your doctor on the shape that you are concerned about, so that we can guide you through on what's actually happening. Then we will let you know, because most of the time how it was tied, actually we don't tie the umbilical cord, we just clamp it and let it fall off by itself, so it shouldn't affect the shape of the belly button. Yeah, I hope I answered your question.
Okay, thank you, doctor, for the answers, and thank you for question, and I hope the answer helps us to understand about the newborn care. Okay, so we have one question here. Stem cell storage, how much it costs?
Okay, just for the storage of the cord blood, our price is about 6,600. This is for a period of 21 years. So roughly around 200 plus per year. I think it's quite affordable for many. Okay, we have installments up to 24 months. So after that, there's no more payment. Just within the 24 months after you finish your installment, no more payment until the child turns 21.
Thank you, Mr. Poon. So do you have any questions? Some more questions? Okay, maybe Dr. Chung or Mr. Poon, you can give us your email so that if the participants today do have any question, they can contact you directly.
Sure. Okay, we'll do.
Mr. Poon, we have one question here. How about if the blood or the stem cells didn't use?
Oh, you mean after the period of 21 years? You can, we have not reached to the period of 21 years. We are only 20 years old. Next year is our 21. We are planning to give option to the parents, okay, to whether to extend it on an annual basis. And then they also choose to terminate it. So in case there's no use after 21 years, then either we terminate it, or we can get it as a donation for research or whatsoever.
Okay, looks like we do not have any questions anymore. So we hope that with this informative sharing today will help you to understand about the newborn care and about the stem cells. So we have finally come to the end of our session. So we would like to give our million thanks to Dr. Chung and Mr. Poon for willing to spare some of your time to be with us today. So before we end the session, we from Pustaka would like to promote our Reading Seeds Kit for any parents who have kids below the age of 3 years old, especially for pregnant mother. You can get this Reading Seeds Kit for free. So all you have to do is to join our Reading Seeds course through Open Learning. So if you have any inquiries about the kit, how to get it, how to go through the Open Learning, you can just contact us in Pustaka Negeri Sarawak. So that's the end of our session for today, and till we meet again in another session. Thank you so much.
Thank you.